Hi, I'm Elaine, and I live with autoimmune disease, and this is my adventure. My chronic illness journey started at the age of 20, when I woke up one day sick. Like all autoimmune disease or chronic illness, you're fine one day and the next day you're not. I was in college. I lived 1 year undiagnosed with a gastrointestinal illness. I found myself at UCSF, where I received my first chronic illness diagnosis of bile salt malabsorption, idiopathic. I guess we should have known then that something was wrong with my immune system. My small intestine died, and they didn't know why. Pretty much thought that my immune system had killed it, but didn't know what exactly the cause was. I was given experimental medication. It seemed to work. I was able to return to college, graduated, dated, got married, but then at the age of 30, bam, I got hit again. I woke up every morning feeling like I had run a marathon. My joints hurt, my hands were swollen, my knees were swollen, my neck hurt. I had rashes and sore throats, and I was always sick. And I went to the doctor, and the doctor, and the doctor for a year. After I ignored it for a while, just thinking it was my previous chronic illness, I was wrong. And after a year, my primary care finally decided to run tests for autoimmune disease. Things just weren't getting better, and the rashes were getting worse, and the swollen joints were getting worse, and pretty much everything was getting worse. At that point, I could barely walk. And the blood test came back. It wasn't just autoimmune disease. It was rheumatoid arthritis, seropositive, pretty much inflammation in my blood, SED rate, CRP, rheumatoid factor, it was all there. And then I found myself at the rheumatologist, like we all do. After blood tests and our primary care is not knowing what to do with us, that's where we end up. I was sort of lucky in a sense because my diagnosis was seropositive, meaning they could find it in my blood. However, there's a lot of patients that are seronegative. Their illness is just as bad as seropositive. I just got lucky because they could find mine. And when I went to the rheumatologist, I just needed a workup to confirm the diagnosis. So at the age of 31, I found myself sick with my first autoimmune disease, rheumatoid arthritis, and was still living with my chronic illness, idiopathic bile salt malabsorption. But my adventure continues. Like every autoimmune disease patient, we find ourselves with a multitude of problems. Autoimmune disease never likes to be by itself, so it always wants to bring someone else to join the party. And it was about 3 or 4 years into my rheumatoid arthritis diagnosis that I found myself diagnosed with lupus. Okay, so now I have lupus, rheumatoid arthritis, bile salt malabsorption. But I'm gonna do like I do with everything else. I'm gonna learn how to live with it. It's hard, it's not easy. I'm gonna learn about medications. I'm gonna learn to talk to others who have it. I'm gonna find support groups. And my best defense is to educate myself, because I figure that's what I've done in the past. So I educated myself, and I thought I was doing pretty good. But autoimmune disease apparently just doesn't like to bring one friend to the party. It decides to bring 2 friends. And about 4 years ago, I found myself diagnosed with a third autoimmune disease, systemic sclerosis, or scleroderma. My antibody is SCL70. It can be a false positive, and I was praying for that. But I learned that it's not always a false positive. How did I know that the third autoimmune disease joined the party? Well, it wasn't so clear-cut. Because I already had GI problems, I assumed that my GI problems that were worsening were just due to my bile salt malabsorption. But everything seemed to be a little different. This was affecting me from my mouth to my bottom, and not just my small intestine. So I had to approach it and tell my rheumatologist that I thought something else was going on. But like every autoimmune disease patient, we don't want to seem like we're a hypochondriac, like we're overthinking everything that's wrong with us. But yet the skin on my hands was so tight It wasn't my joints hurting anymore. It was like I couldn't bend my fingers because they were gonna rip. So here I sit, 43 years old, 3 autoimmune diseases, 1 chronic illness, probably tied to autoimmune disease. But I have a lot of adventuring behind me. I have a lot of adventuring ahead of me too. Diagnosis is hard, and sometimes you find yourself alone. You're not. There's other people like you. I felt alone for a lot of my journey. But there's a whole secret society of us. We live amongst you. So why do I want to share my adventure with you? Because I know what it's like to be at the age of 20 in college and finding yourself sick. I know what it's like to tackle college not particularly well and different from other people. I know what it's like to date and have to break that news to your boyfriend or to share with your fiance how life might look a little different. I know what it's like to get married with an illness. I know what it's like to start a career. I know what it's like to have to take a leave of absence from that career or work. I know what it's like to hear you can't have children. I know what it's like to be denied adoption because you're sick. But I also know how to adventure. I would love for you to join me on my adventure, to come along with me on my good days, on my bad days, to my travels, to the times that I can't get out of bed, like today. Side effects from medications are real. I'd love to share all this with you. And whether you have chronic illness or autoimmune disease or a friend of mine, I would love for you to join my channel. So please subscribe. Leave me a comment. Let me know what you would like to see, what you would like the world to see about living with chronic illness or autoimmune disease. Come along on my adventure. It'll be fun.